Now, the disease has been in the spotlight for several months, but with the first case here in the U.S., the question is now, are Capital Region hospitals prepared to handle cases if any are confirmed in the area? One area hospital says they're ready if infectious disease arrives. News 10 ABC's Heather Kovar joins us now live with more on how Ellis Hospital is ready. Heather.
Elisa, well, Ellis Hospital says they did not wait until the United States had its first case. They said instead, as soon as there was the epidemic in West Africa, it started putting a plan in place in August. They now have a protocol. They have training going on. They've even put together some Ebola kits to treat potential patients.
You can see it gives you full protection of your face.
This face shield, masks, and fluid-resistant isolation gowns are a few pieces of the Ebola kits at Ellis Hospital.
They're easy, and our staff are very familiar with these. They're familiar with all of this personal protective equipment.
Eve Bankert is the Director of Infection Prevention and Epidemiology.
What the community wants to know is that we are prepared to handle any potential patients that could come through our doors.
She says they are prepared and continue to train.
We've identified key staff members that would potentially come in contact with these patients.
They're learning how to identify potential Ebola cases and how to isolate them right away, as well as be in contact with state and local authorities. I spoke with other hospitals. Glens Falls says they are ready, but that an Ebola case there is a low likelihood. Albany Med says they're continuing to seek guidance from the CDC and are taking all necessary precautions against that and any other infectious diseases.
We use isolation rooms every day to treat a variety of infectious diseases. So this is no different, really, than any other infectious disease that we might encounter.
Several hospitals told me Ebola can be easily contained in the U.S. and that they deal with infectious diseases every day, saying our health system is very different from the conditions they're struggling with in West Africa. Well, basically, the hospitals say if someone comes in with a fever and say, yes, they've traveled to certain countries and they go into an isolation, and then that is when the Ebola kit would be used. Live in Schenectady, Heather Kovar, News 10 ABC.